And the final panel will be moderated by Marianne Brenda. She's project officer at the HealthData Hub, and she will invite the panel members over. Over to you.
Hello, everyone. Good morning. So thank you for all the speakers. It was really, really interesting, really insightful, and for the use case also to see the challenges that we have and what the HDS could brought to research in Europe. And now it's time to broaden a little bit our focus and to connect this pilot project with the other initiatives that are currently taking place in Europe on the coming initiatives. So I'd like to introduce our panelists for today's discussion. So we have Ander Eluston-Ojoregui from the European Commission. We have Marcus Kalliola from Citra. Juan Arenas from Elixir. We do not have Eva, but we have Peter from BBMRI, and we have Denise from the EMA. So thank you very much for agreeing to take part. Please take a seat. And we are going to make this as interesting, not interesting, but interactive as possible. So each of our panelists will give like a short overview, a brief, or initiatives that connects with the pilots. And then we will have a question and answer session. So don't hesitate if you have like something to say. I can give you the floor anytime you want. So our first speaker is Ander from the European Commission. And I think you are going to tell us a bit more about the whole EHDS and how this project fits into the...
Yes, hello, good almost afternoon. So it's a little bit difficult to introduce the EHDS to this audience because you know a lot about it. So I thought that instead of talking about the EHDS, I think I can pass on a couple of messages basically in this introduction. So I think one of them is that, first of all, this is not a green field. I mean, it was very clear from the beginning of this stakeholder forum session that we're not dealing with a field where there's nothing. There's a lot happening. It's very dynamic, and there are also some very important connections happening in the field across many different stakeholders. I think that's the first important bit of the European health data space when it comes to secondary uses of health data. Then the second part is that although there are all of these initiatives on the ground, we see, I mean, there will be quite a lot mentioned in the panel as well, but it's also important to mention that these connections are still weak at European level. So cooperation is still not mature, or not as mature, for example, as what we see in the area of primary uses of health data, where cooperation has been ongoing for 10 years in the context of the Cross-Border Healthcare Directive. So I think there's quite a lot of work to do there, and that's where, for example, TEDAS came in, and Marcus, of course, can tell more about it, and that's also where the pilot also fits with more tangible results, for example, when it comes to the infrastructure, technologies, etc. But then there are still a lot of projects to come with the direct grants, so member states increasing their work when it comes to the deployment and development of the health data access bodies, and also in other areas, capacity building, etc. So this is the message I can pass to start with. Thank you.
Thank you, Ander. You mentioned Marcus. You might know Marcus from the Joint Action TEDAS, and there will be another Joint Action TEDAS that is going to start soon, and Marcus and Citra will be coordinating this project. So please tell us about this new initiatives, what is the timeline, and how you will be able to use the results of this pilot project to feed into TEDAS 2.
Yes, good morning or afternoon also from my side. Yes, so I'm Marcus Kalliola, and I was the coordinator for the TEDAS Joint Action that started in 2021 and ended on July this year. And as you know, it created the concept and promoted the European health data space, something that the HealthData EU Pilot is now piloting. I was very happy to see a lot of the results of our work in the slides that you just saw this morning. So it's a real example of how these projects feed each other and how we actually work quite well together. And I also was very happy to see that one of the first slides today where we have the different initiatives. So when we start a project like that or event like that, we actually look into the synergies when we start, and I think it's a very good example that you set today. So the TEDAS 2 planning will start on Monday. So we were chosen as a coordinator on Thursday last week, and the project will then finally kick off sometime in the middle of next year. It will build on to what you are doing here. So we will look into the practical findings that you had from the pilot and build on towards of your work then, and then pass on that into the member states as a guidelines and technical specifications to support finally the implementation of the ESDS. So we actually go towards the implementation with this pilot and then the data through action.
Thank you, Marcus. I think we also have like a lot of other projects that are related to the EHDS and to health data in Europe, but that are currently going on. And I would like to introduce Juan Arenas from the Elixir, who is head of the project management unit. And I think you are going to tell us a bit more about the GDI initiatives and the work you are doing at Elixir.
Yes, that's correct. So, but let me start by why we have the European Genomic Data Infrastructure project. This is a project that is supporting the scale-up and sustainability phase of the 1+NG initiative. That is a political declaration that 13 countries signed in 2018. Now we have 26 countries that have signed the declaration, and they are willing to share genomic information and phenotypic information across borders. And this is the project that is actually making this happen. We are building this infrastructure as we speak across 24 countries from November, when we have 4 new countries joining the project. And we already have a starter kit that countries are deploying, helping them to test the infrastructure. That starter kit is coming with 3,000 whole genomes and associated phenotypic information, this synthetics, of course. And this is ramping up a lot. We have a lot of iterations with the European Health Space and a lot of collaboration. I think I need to contradict Ander. I think the collaboration is already happening. We can do always better, and I think we will do better. But I think there's very nice examples. We will have a first version of the 1+NG data catalog early next year, and this data catalog will be fully supporting the CAT-AP standard. So the moment that the European Health Space catalog is there, the data will be harvested and will show up in the portal. So we are doing quite a lot of things and try to coordinate both projects. Of course, the interoperability across initiatives and across projects is always tricky. And it's not only at the technical level. It's not enough to have the same technical solutions. You also need to have interoperable governance or some way that the data can flow easily between infrastructures, initiatives, and data spaces. And that's a big challenge, and it's still unresolved. But I think we are all trying to tackle that collectively, and we'll find solutions, I hope. Just to say a bit more about the genomic data infrastructure, we also have, apart from the Pillar 2, where we are doing the deployment and the operations, and we will have to be fully operational in 2026 across 15 countries. So we need to show how people can access and analyze this data. On top of that, we have Pillar 3 that is looking at innovative solutions, and that's where we are looking at federated analytics and federated learning. And we are coming with some ideas and standards and open source solutions that we can put together there. And of course, we are also looking at the long-term sustainability, and the genomic data infrastructure is working with the member state representative to create a legal entity that will be an EDIC that will be carry on this activity after the end of the project. So this will not end with the project. When the project finishes, it will continue. On top of that, there is new initiatives that the Commission and the member states are supporting, like the Genome of Europe that is starting next year, where we're going to collect 100,000 whole genomes that will represent the European population, and that data will flow into the infrastructure, and therefore will flow into the European data space as a consequence. So there is quite a lot of things ongoing. I think we are doing very good progress. Last week I was in Rome with 95 people from 20 countries that are working on the deployment of the national node and in connecting them across Europe. I think, just to go back to my initial comment, I think collaboration is happening, and we, of course, can improve that, and we need to keep pushing on alignment and interoperability across initiatives and across projects.
Thank you very much, Juan. And I think you mentioned interoperable governance, but also more technical things like standards, data standards, how you can analyze data. And I think for everything that it's related to interoperability, standards and security and all, Peter Olub, who is from BBMRI Eric, and who you've seen previously, because he's a work package leader in our project. Can you tell us a bit more about the various projects that you are handling at BBMRI and if they are connected to the HealthData at EU Pilot project?
Yeah, so it's also not only the projects, and I'll get to the projects, but in the first place, BBMRI is a European Research Infrastructure Consortium, and ERIC under the European regulatory framework. And as such, based at least on the proposal of EHDS, we are also authorized participant in EHDS. And we are still currently looking for or discussing also with the European Commission the role of ERICS within the EHDS ecosystem. Because BBMRI is a federated research infrastructure spanning 24 member states, and we have data that is national, but we have also data sets that are international. And how the governance of such data sets is done. For instance, it probably does not make much sense if a Czech HDAP is deciding on giving access to German data, in case that you have already integrated data sets. So we're looking in these data governance challenges and how to make EHDS an environment in which this can be resolved in an easier way, and possible such an international HDAP role could be a potential role for BBMRI. Another aspect is that BBMRI has also policies for data return, and that's something we have to look into in EHDS as well, as we have already mentioned it in the use cases. We're even discussing with them if they're considering data return through EHDS to enrich existing data resources with additional data. So if somebody develops some derived data from the primary data, should it become also accessible through the same mechanisms of EHDS? And who is going to host it? The RIs, the research infrastructures. And I think this also applies to Elixir to some extent, at least, could be home for such data return mechanisms. In terms of other projects, we're marginally involved in GDI as well, but I would take a step back, and we need to realize that there is actually multiple of those initiatives that are happening at the moment. It's EHDS is being set up, and for us, we have invested a lot in contributing to EHDS because we see it as the regulatory mechanism, how the data access can be streamlined and made more efficient. But there are other initiatives that are building kind of perpendicular data spaces. It's GDI for genomics, but of course phenotypic, potentially clinical data as well, because you need to correlate those things. EU came doing it for cancer imaging. That is another activity stemming from the calls from DG Connect. And we need to figure out how those things are going to play together, because we should not create another riverbanks only to then figure out how to build bridges across those riverbanks that we have carefully created in the first place. So how can we synergize those things when they're being developed? I mean, EUCAIM has now released first version of its infrastructure at the end of September. First week of October, basically, was a public release with the catalog, with the access negotiation mechanisms, with the even federated availability querying in place. And it also covers different sorts of imaging, but it also covers clinical data, phenotypical data, because the imaging without those data is also in vain. And if we look at the landscape, EHDS is working with the current proposed regulation. Again, it has all those things in scope: genomics, clinical data, imaging data, exposome data. So we are committed to work on bridging those things and creating as few boundaries as possible, so that we then don't need a lot of other projects just to find how to build the bridges between them. Let's put it this way.
Thank you. In France, we have like an expression that's créer une usine à gaz. I think it's like to say that you are making things overly complex, and instead of having an EHDS that is the life for everyone and to foster European projects, we need to make sure that it really does that and that it's not overly complex, needlessly complex. And about the role of research infrastructure in the EHDS, I think maybe Ender, you could tell a bit about that maybe later, because yes, there are various actors that are going to work in the EHDS. We have like health data access bodies, we have national infrastructure, but we also have this research infrastructure, and it would be interesting to know what they are going to bring to the table and their added value. And now I'm going to give the floor to Denise Oumoué, who is an epidemiology and real-world evidence specialist at the European Medicines Agency. And I think you might maybe touch upon a little bit about initiatives such as Darwin, but more globally about the role of the EMA.
Thank you. Yeah, so I will talk about Darwin EU that my colleague Daniel already mentioned earlier on. But before that, maybe I will provide a bit of contextualization of Darwin EU for regulators. So in the context of regulatory work, we generally have very tight timelines because our committees that assess medications have questions and they have to respond or put in place systems to be able to allow or authorize medication so they can arrive quickly to patients. And in some cases, these committees have questions like, what is the prevalence of a disease? Is the clinical trial feasible? Is the monitoring of safety going as expected, and it's the impact really there for patients? And all of those questions need to be answered rather fast, because there are timelines that need to be respected, and sometimes 60 days is required. And so you can imagine in the environment that everybody has described now, where access to data is generally taking a long time, and you need permissions, you need review, you need authorizations. So in some instances, we cannot afford the time. And this is why for regulators, for EMA, for example, we have actually 3 pathways for accessing real-world data and generating evidence that our committees need. So we have on our servers what we call in-house, some databases, but only for 6 countries in Europe. And as you remember, the agency serves all European countries. So we have those databases that our statisticians and epidemiologists can actually access immediately and be able to generate answers within a matter of a month, for example. But these are very limited databases, many primary care databases, so you can also imagine that they don't answer all the questions. And then on the other end of the spectrum, we have what we call framework contracts. So these are academic institutes that are contracted with the agency to run research in a much broader scope, more countries, more data sources, but this takes generally 6 months to a year and maybe even 2 years to run those studies. So we do this when we can afford the time, when we have questions that we have anticipated and we know this will have an impact in future evaluations, therefore we do that kind of research. In between those 2 pathways comes Darwin EU, and as Daniel explained earlier on, Darwin EU is a network of data sources and research and expertise in methods to allow for us to have some questions answered quickly in more data sources, but a bit faster than the framework that I explained at the end, but it takes a bit longer than 1 month of the limited 6 databases we have in-house. And so Darwin EU was put in place 1.5 years ago, and we already really see the impact through different studies that have been generated. It has we have 10 data partners already onboarded, all have data in the OMOP common data model. But the intention is to increase continuously this number of databases. And so this year we will hopefully by the end of the year onboard 10 additional databases, bringing a variety of data sources in terms of settings, in terms of coverage of EU countries. And we've also an increased number of studies. So the aim is actually to be able to conduct up to 120 studies per year. And this is how much we actually look then forward to EHDS to allow us to be able to do this and have a bigger coverage of the European population.
Thank you very much, Denise. And this is a topic also that is dealt with in the EHDS proposal. The aim is to make the deadlines a bit shorter for the health data access body to give the permits and then for the data holder to make the data available. So hopefully it will reduce the time that you have to really access the data and to be able to analyze them and to use them. So I think that was one of the main goals also of the EHDS proposal. Thank you very much for this little brief presentation. I'd like now to ask you a few questions. First to Ender, maybe. Can you tell us a bit more about the interactions of all the projects that are actually taking place and about what you're doing at the European Commission with the implementation of the EHDS in view?
Yeah, so I think when it comes to the implementation of the EHDS, one thing that we need to have in mind is that it's a very multidimensional project and it's a multi-layer project. And this is also reflected in the types of projects and in the types of funding that is used to carry out the European health data space. So with that, what I mean is that, for example, there are programs like EU for Health, which focuses on carrying out projects in the area of health specifically, then combined with Digital Health Europe, for example, in the area of digital, Horizon Europe, of course, in the area of research and development. And then, of course, also other programs and other instruments that are very important for changes on the ground. So, for example, the Recovery and Resilience Facility, the ERDF as well is important here to make sure that the changes don't only happen at European level, but they also have effects at the lower levels of health systems. So they also make changes at the point of care, etc. And there, I think we need to see it as a multidimensional area with at least two key dimensions. One are these projects that I think, Peter, you were mentioning, the vertical ones, which go into deeply into the problems and try to find solutions to them. But then there are more horizontal projects like this one, for example, the HealthData EU Pilot, which tries to find a common solution across different projects, bringing them together in a single action. Of course, this one is a very good example, but then TEDAS 2 is also a fundamental one for the implementation afterwards of the European Health Data Space Regulation. So, yeah, that would be my answer.
I just have like one little question. Could you give us a sneak peek at the negotiations, how they are currently going? Do you think we will have like a EHDS directive soon, or if it's going to be ready for 2024, or maybe if we need to wait a bit more?
It's a difficult question, difficult to answer. I can be very administrative and say it's out of our hands, so it's with the co-legislators now. But okay, maybe going more into the nitty-gritty. Well, of course, it's a very critical period now because the Parliament will have the mandate ended mid-2024. So now negotiations are in a very critical and high-intensity phase. So we need to see. It's difficult to forecast. I mean, from our side, of course, the hope and the support that we're providing to the co-legislators is to make sure or try to at least have the adoption happen in this mandate for the European Parliament. But yeah, I mean, a lot depends on what's happening in the coming weeks as well. So, yeah.
Thank you for providing this little insights. Now, Marcus, so you presented TEDAS 1 and TEDAS 2. I was just wondering if you know already how many countries are interested in participating. How do you see their involvement? And since the action for the TEDAS 2 are more technical, if you think that you will manage to get technical expertise and how you see things for the next year.
Well, there has been more interest for TEDAS 2 than the 1. So in TEDAS 1 we have 25 countries and now we have 29. whether we have all the expertise, I think it's a very difficult question. And of course, everybody who's listening, who are participating in the DataS 2 is to encourage you to find the expertise that we really need in order to provide quality results of the project. But it doesn't end there, so we need also the stakeholders. So everybody who is listening here, I mean, we welcome them to become a part of the DataS 2 community. In the call text, there's a requirement that each of the product that we will release, there will need to be an open consultation period, so everybody can actually pitch in and provide their expertise for our work. I would like to refer to some of the earlier comments made here, if you allow. So I think we already have sort of a mini ESDS working in Finland because we have the Health Data Access Body there. We are also participating, for example, the Darwin EU and also the research infrastructures. I fail to see the problem with the ESDS and the Health Data Access Bodies compared to the research infrastructures, because we have, for example, university hospitals which has already contracts with the Darwin EU, and they are working at the same time as we have the Health Data Access Body working. The data doesn't go through the Health Data Access Body in this contractual situation, and the Elixir is working and so on. I think we need to find a way to look at when the data request goes to the Health Data Access Body and when not, and I think we will find a way. And when it comes to the regulation, I really think we all need to push our decision makers into making compromises in the council, because if we fail to agree on this, then it's a very bad sign for the whole EU.
Thank you, Marcus. Juan, thank you for your presentation on the Elixir and the GDI initiatives. One question from the previous presentation and from the various work packages that we have in our project, so governance, legal, metadata standards, or interoperability, do you have like one topic that you are particularly interested in, where you think that you can really get inputs from the HealthData at EU projects for Elixir or for GDI?
Well, I think we are involved almost in all work packages one way or another, and there is a lot of collaboration happening there. As I mentioned before, DKTP is now the standard that we are going to use in the GDI data catalog, but it's also discussions on metadata models. With the work that we did in the use case with BMRI, we aligned the 1+NG minimal data set for cancer with the colorectal cancer. So there is a lot of collaboration happening and a lot of outputs coming together. And what we aim in GDI is to provide, in fact, we have the first release out with the starter kits. It's a set of solutions that people can look and use when they have the need to manage genomic information. And then it can be deployed in different ways and support different governance. But we are continuously learning, not only from the European Health Space, also from the European Cancer Image, where we also participate, and where we are learning and working with them on the development of more advanced features like federated learning. So I think we have almost at least one person involved in every work package in the European Health Space, and we are also doing the opposite. So in our monthly meeting in Pillar 2, we have people from the European Health Space attending, and we will extend that collaboration after we discussed a few weeks ago with Mario. We will invite also work package leaders from the European Health Space to join some of our work packages, the ones that they're interested in. And that makes sense because we need to make this connection happen. So again, countries doesn't want that we replicate efforts or that we replicate infrastructure, that we create silos, and we need to avoid that. And that's the common effort that I think all people that is here is really interested on avoiding that as much as we can.
No, and it's great to have you as working on the use case from Elixir, and also Denise working on the use case from the EMA, because you have like really the experience and know what are the hurdles and what would be the lessons learned to make the HDS really working. So it's great to have your inputs. I have just one short question for Peter. So in BBMRI, Eric, you are involved in a lot of projects, but what do you think would be the most interesting connection with this pilot projects? If we need to involve maybe people from EKM or other initiatives, do you think that there are critical synergies that would really benefit the implementation of the whole EHDS?
Well, absolutely they are, and that's not a short question. The question was short. The answer might be short or long. As Juan pointed out for GDI already, across those initiatives, we need to align the discovery mechanisms, access mechanisms, requirements on the processing of the data if there are any constraints. I mean, eventually we need to think about it also from the perspective of the data sources. As BBMRI is federated, we have it on our plate every day that the source institutions are complaining we do not have resources to actually implement it. There is money poured into building the national or the international governance layers, but then it boils down to the, in our case it's biobanks, biomolecular resources, but they're part of hospitals, they're part of universities. And these also need to be empowered in that sense to actually comply with the requirements that are coming out of it. And they're, in many cases, they're involved in building GDI or building EU CAIM. Probably less so for now in building EHDS, and they're heavily contributing to the research infrastructures already. So we need to make sure that we have a consistent set of requirements for them, what they should implement, because otherwise no budget will be sufficient to make them survive and be efficient in providing the service that we're expecting on different fronts from them. And of course, it's not necessarily an easy situation because that's sometimes also about competing groups that are building competing ideas or standards. So we are trying actively, and BBMRI is heavily involved in EU CAIM, basically in all the prototypes or all those infrastructure components that were now released are basically coming from BBMRI. These are we are trying to proactively align it. So when we are developing access negotiation mechanisms here, the protocols, how the data would be exchanged between HDAPs, it's something that also back-propagates into those projects. And I think similar we can say about GDI. But we really need to look at it from this side of those end institutions that are then, without those, we can have beautiful HDAPs, we can have beautiful international, national infrastructures, but if those are not functioning, if we're not getting the data, and I think the use cases in the HDS pilot can actually confirm that, that's one of the hurdles. They are in many cases stuck on getting the data, and that stems from the support of the local institutions. So that would be the most critical part. And of course, taking the RI hat on, we also need to really settle position ourselves because we are authorized participants. So does it mean we are supposed to act as HDAPs for the international data sets, for instance, or not? At the moment, TEDAS and similar activities are running on the national level primarily. So as research infrastructures, Elixir can't be part of it, BBMRI can't be part of it. We can have some people from the member states participating, but that's not a link that would take it to the same level as if we're part of those directly. So I would say that's another important component.
Yeah, I think it's working now. So if I can add to that, I mean, it's clear what Peter mentioned, the need to don't replicate solutions, and that's why we in 1+NG and through B1NG has developed the 1+NG framework that basically bring together the standards on genomics that has been being developed in the last 10 years in Europe, and that are also now global standards. And we basically provide open source reference implementation that fulfill the standards. And I think that's the way to go. So we need to agree on the standard, on the APIs for communications, and then get freedom on the solutions, because that will also increase the innovation side. When people have to implement the same standards with different solutions, we find other things that we cannot find if we have a monolithic solution. So we need to find the balance between central services and then node services that could be customized for the needs of the different providers.
Maybe just a little reaction. I think this nicely shows how BBMRI and Elixir in a way are complementary, because Juan automatically thinks about the APIs and the say the programmatic processing of the data. I look at it primarily from the perspective of the data sources, because BBMRI typically acts as a data source, even for Elixir initiatives in that sense. And we need to have those things coherent, and definitely this alignment on technical level is conditio sine qua non, Latin speaking.
And the other aspect that is important, and it was mentioned also this morning, is the training and capacity building. We can see in most of these projects, we can see the same people across all these projects, and that is a sign that we have people that have very good knowledge, but also it's a sign that we are probably not building enough capacity. And you know, if we start to have 1+NG, European Health Space, European Cancer Image, and all the ones that will come that will also need to assess, and we create fragmentation, we are going to have a huge problem for resources. And as Peter mentioned, you know, the people that is in the data providers, they need to answer all these different requests from different initiatives and projects, and it will be really hard if we don't have the right people with the right skills in place. And that's why when we design GDI, it's a kind of capacity building exercise when we bring 24 countries to raise the capacity on deploying the infrastructure, so we have people really to operate the infrastructure when we finish the project. But there is other parts that we cannot cover, like the data management, that is critical, because it's not only about getting the data, it's also you need to get the data with the quality level that it actually can be used and can benefit researchers and policymakers. And that's also a huge point, and another area where we need to look very careful on how we ensure that the capacity is there.
Thank you, Juan. And now, Denise, thank you very much for being here. And I think one of the things that was mentioned, and you are working on the use case of the EMA, but you're also working, I guess, in a lot of initiatives at the EMA. But one thing that we heard several times is that right now there is data access is quite complicated and can be really lengthy. Do you think it's one thing that the EHDS could help you with in your work, or what do you think the EHDS could really bring to ease the work of the EMA?
Thank you. Yeah, I think data access is something that we are experimenting as a big challenge actually in the pilot, and I really hope that all the lessons learned that will be generated will really be taken on board. I think majority of the use cases are currently all a little bit stuck at the data access aspect, and you almost see a little bit of a difference, and I'm thinking about previous presentations in terms of implementation and the means that will be put to member states to implement the legislation. So there's one thing that the legislation goes through. There's a second thing as to how each member state is going to implement it. And you can see that some of the small countries that did not already have this kind of have data access bodies like are a little bit more agile in the way they handle requests for data access, as opposed to the bigger or more traditionally well-established countries where they need to adapt to the new legislation, and it's almost easier to come with something new and with a blank sheet than to have something and then scratch through and then adjust and then put in place the new way of doing. So EHDS represent a hope for us actually to have these systems, these processes take a bit less time in terms of implementation. As I mentioned earlier, time is really critical in the work of the regulators, and so we actually, funny enough, during some of the discussions, I think it was my colleague Daniel who came up with this abbreviation of real-world data becoming rapid, wide, and deep, and that's the hope for, I think, for all researchers, and especially for regulators, where all those three words really mean something. So more data, quicker access to data, and smooth access to data, and we can learn a lot from the ongoing use cases. We can tell off record later on with when we will be chatting about how we are experimenting, requesting data access to the CNIL, for example, and I think all use cases have lots of jokes about that. And so that's for the rapid aspect. Then you have the deep and wide aspect where if you want to do work for all European citizens, it would be good to be able to have information that represent all those citizens. So broader access in terms of geographic coverage, as I mentioned earlier, but also in terms of settings. So in many countries, it's easier to access certain type of databases, but the more specialized data, for example, the genomic data that we're talking about right now, these are data that are not so easy to access to. And then there are elements of balancing privacy, data protection with possibilities of linking data, which is really critical in some cases. There are questions that you need to link different types of data to be able to answer those questions. So it's really about balancing all those different pieces, and again, going back to how each member state is going to implement the legislation, so that even if the conclusions are taken into account and the legislation goes through, then we don't get stuck at the implementation part, and then all this work will not have served much.
What I will, oh yes, please.
Can you tell us one CNIL joke?
Afterwards. Otherwise it will be recorded and maybe not.
I will remember the jokes about the CNIL, but I will also remember that you mentioned that there is hope, and you hope that the HDS will smooth things. I will just like to conclude, because we are coming to the end of this session. If there were a word or something that you would like the HDS to create in one sentence, what would it be? Under, maybe?
I think that Europe-wide collaboration, that would be what I would like to see with the European health data space. It's also true that it already exists, of course, to some extent in many ways. Also, for example, in primary use of health data, we also have that. But I think the little conversation that you just had between Peter and Juan, I think that was a very nice one to see how cross-project or cross-initiative collaboration can work in practice. And I think this cuts both ways. So from the European level to the local level, but also from the local level to the European level. So that's something that I would like to see of more. And I think it's also important to use these kind of projects as a reference point to disseminate the knowledge across different layers and different sectors as well. I think you were mentioning also capacity building. Of course, that's something that we also have in mind, and there's also an action that we're preparing in the area of capacity building. The diagrams will also cover that area as well, of course, when it comes to the technical deployment. But I think it's also important to take the knowledge from these kind of projects and also disseminate it further beyond their original scope and also their duration. Yeah.
Thank you, Marcus.
Was that one sentence?
I was about to say it.
Just a couple.
I think we need a regulation what the one sentence means. So one sentence for me for the European health data space would be access to data for citizens and researchers. Thanks.
Yeah, I could subscribe that. It's difficult to find a new one. I think it's also, what I would like to see is the reuse of the research infrastructure in this initiative, building on the knowledge and the expertise that is already there.
A framework in which we can streamline the data. So I think Dennis actually pointed it out very nicely, that it's rapid access to wide, deep, quality assured data, and into which all the current initiatives can contribute, and it does not get blocked on formalities, on complex administrative mechanisms, but streamlines it.
And Denise, maybe if you would like to conclude.
I don't know what to add to all those very nice one sentences. Maybe a bridge to the primary aspects of healthcare data. And I'm saying that because in the break I connected with one of your colleagues who is working on that. But when it comes to the quality, I think the work will probably also start from the primary part of data collection. And so again, hope for more rapid, wide, and deep data of great quality and less hurdles, unnecessary for the implementation.
Thank you, Denise, and I'm sorry we have to conclude this panel, but it was really interesting, and thank you for your really valuable insights. You'll be able to continue the discussion. I think for the people of the project, we have like a whole day and tomorrow also ahead of us. Thank you very much, and I will now hand over to Maike.